Today, our nation is suffering from an epidemic of chronic disease, a preventable epidemic enabled by the places and spaces and relationships that shape our choices and can challenge our health on a daily basis. This is the health crisis of our time. We can prevent our way out of this health crisis through primary upstream prevention interventions, physical activity being the most impactful among them. Physical activity is a near universally available, low or no cost, quality of life year expanding and life enhancing intervention.
The U.S. National Physical Activity Plan was released in 2016. It's an action plan building off the recommendations of the Physical Activity Guidelines for Americans developed by the U.S. Department of Health and Human Services in 2008.
I often describe the plan as a roadmap for changing our communities in ways that will result in many more residents of those communities being physically active.
The National Physical Activity Plan was produced by representatives of leading health organizations and more than 300 physical activity experts in an effort to encourage necessary environmental, cultural, and policy changes.
Having a well-developed plan is one step in making the connection between the body of knowledge on the one side, research and professional experience that tells us what we think will work, and putting those initiatives in place at scale across the country.
The National Physical Activity Plan is organized around 9 societal sectors and includes overarching priorities and numerous evidence-based strategies and tactics, all based on the vision that one day all Americans will be physically active.
Everywhere we live and breathe, movement happens and health happens. And so this plan is about creating that America where movement is what we do.
Who is responsible for helping to make physical activity a national mindset? I am, and you are.
Change begins with raising the level of awareness, and we all have spheres of influence, and what we need to do is to really exercise that influence that we have, whether it's in our church community, the faith-based communities, whether it's in schools, whether it's in the workplace, because it's really being able to get people to change their behaviors where they work, live, play, and pray. And it really starts with us as individuals taking advantage of those areas of influence that we have.
Learn more about the National Physical Activity Plan at www.physicalactivityplan.org.